My name is Mia Scott and I'm a nurse practitioner here at Rixa Health, and I'm going to teach you guys how to give yourself an injection. First thing I want to point out is your syringe will always be labeled in units. Now this is a 30 unit syringe, but you could have a 50 unit or 100 unit syringe based on the syringe that the pharmacy sends you. But whatever you do, pay attention to the units that it's telling you on your directions. For example, inject 10, 20, 25 units, etc., subcutaneous. So the first thing that you're going to do is open your alcohol swab and you're going to scrub the top of your bottle. And for this, I'm going to do 10 units. So I'm going to draw back air just to the 10 unit mark. And then I am going to flip my vial over because gravity, your medication has to fall down. And you're going to inject that 10 units of air in and immediately just draw back to the 10 unit mark. Now, this is just a little bit of a trick that I use. I always draw up more than what I need to get all those bubbles out and make sure that your syringe is actually filled with 100% of the medication. And then I'm just gonna push back up until I get back to the 10 mark, which is what I need to inject. Once you're there, just stabilize your syringe and you can pull out, and that is it. And then you can sit this on a table. Typically, I like to put it on like your alcohol swab as long as that tip is not touching anything. And then you're going to rub your belly. The more that you scrub, the less that you will feel. So kind of just scrub so it feels a little bit numb. And then when you inject, you want to inject straight in like this with your finger on the plunge, and you're going to inject straight in. 1, 2, 3. And you inject everything and pull out slow. And then you cap it. A little education piece here: when you cap it, it would be a scoop method just so you don't accidentally stab yourself. And you can refer back to the after visit summary for disposal of your sharps.